I'm Dr. Deuk. I'm here with one of my patients who some of you have seen before. This gentleman had a lumbar fusion done at Deuk Spine Institute 6 weeks ago, and so he's here for his typical 6-week follow-up. We get x-rays at 6 weeks and his x-rays look perfect. We were able to recreate a natural curve in the bottom of his spine. So you came in to me because you're having, what, horrible back pain and leg symptoms?
Like an average of a 7 and an 8 level-wise.
Okay.
Yes, and then the tingling down my left leg, and then this leg seemed worse when we did the EMG, but I didn't have any feelings, so, and it's all good. I feel like 100% new person.
Yeah, so since you said it, do we cure your back pain?
Yes.
And what do you say to the people out there that don't believe back pain can be cured?
I'd say give Dr. Deuk's office a call and give them an opportunity to look over your stuff and see if they can help you.
Yeah.
Because it did me well.
Yeah, we cure back pain all the time here at Deuk Spine Institute. It can't be done in most other places, so you have to be very careful where you go to get your surgery done. Now, you have a neighbor or somebody that you know that just had back surgery. Tell us about the difference between your experience and theirs.
Yes. I met this gentleman on Saturday, and he was 4 weeks out using the cane. I used the walker first couple weeks, maybe the first week to my first visit, and then after that, no more walker. I could tell at 4 weeks he was still in a lot of pain. At 4 weeks, I'm up and moving, just wearing the brace as recommended, and going to PT with no problems. My pain was only averaging 1 to 2, maybe 3 sometimes, but overall I'm doing great.
Now, you had your surgery done where?
Right here at
Deuk Spine Institute,
yes.
basically, the surgery center.
Yes, the surgery center
And
right here.
were you in the hospital at all for your surgery?
No hospital.
No hospital. And what happened at the end of your surgery when you recovered? Where did you go?
I went home.
You recovered at home?
Yes.
Yeah. So no hospital stay, recovered at home, same day surgery, went home the same day, a few hours after surgery. And what about this other gentleman you met? Where did he have his surgery?
From what I understand, he had it at OMRC.
ORMC.
And he was there. He
It's
said
a hospital.
Yeah, 4 days, and then he had other other things afterwards. So, and I could tell he was still in pain.
Yeah, still having problems. Very typical for people that have spine surgery done elsewhere. It's sort of the average. That's what's expected. At Deuk Spine Institute, our patients go home the same day with minimal pain, and they have great recoveries like this gentleman's had. So what are you going to do now that your back is fixed, your leg is better? What are you going to do now?
Enjoy my grandkids, go back to work on Monday, and be able to ride my motorcycle again. Haven't been able to do that in a long time.
Enjoy life.
Enjoy life,
and not
yes.
worry about back pain taking
Yes.
control of your life. Where do you work?
I work at the Space Center.
Kennedy Space Center.
Yes.
Yeah. And you have, this is a special date today, isn't it?
Yes, they're having a launch. This is a great day for NASA.
Yeah, it's a manned space launch. It's the first one, right?
Yes, in 10 years, since 2010.
So there's lots of crowds here at the Space Coast, and people are all excited about the launch. Hopefully it's going to happen, weather permitting, right?
Yes.
It's going to be a historic, epic day. All right, anything else you want to say before we wrap this up?
Nope, just if you have back issues, please give Dr. Deuk's office an opportunity to talk to them. They've done me well.
Thank you. Appreciate it.